starts right now.
Forget the sound of silence. This week, our newsroom has been filled with the sound of sickness, coughing, sneezing, sniffling, and moaning. That'd be Luke, our producer. On Facebook, we heard from dozens of you dealing with the same thing, either at work, school, or home. If you thought we were over the flu and cold hump, well, not a chance. It's back, better or worse, I should say, than ever. Good evening. I'm Stephanie Vigil.
I'm Dan Kleckner. This flu has sent 44 people to the hospital since the start of the year, and that's just in Spokane County.
In compounding the problem, school started back up today for the biggest districts in our area. Kelsey Watts spoke with several school districts about, she's also live in the Connect Center, to talk with the Connect reps from the Spokane Regional Health District.
And Kelsey, how big a concern is the flu season this year?
Well, Dan and Steph, those officials at local school districts are certainly crossing their fingers right now. I called several of them today, and overall I heard that things on this first day back at school after winter break actually went pretty smoothly. That is certainly good news, of course, but it may not paint the entire picture, and here's why. Some districts are only required to report those absentee rates to state officials when they hit 10%. Some other districts only report data every week through a partnership with the health district, so we may not really have a clear picture until the end of this week, perhaps even early next week. But here's what we do know right now. It has to do with flu-related hospitalizations. For this day last year, there were 18 people who had been hospitalized with the flu. As of last week, that number had been 45. And here's where things really get scary. Just in the last week, this number has doubled. We learned today 90 people in Spokane County have now been hospitalized with the flu this year. And that's why it's so important to talk about and why we have these health district officials here with us in our Connect Center tonight. And Mark Springer is here. Mark, I want to ask you, during the huge H1N1 swine flu epidemic in 2009, I was one of the many people who got it. And I know you're getting a lot of calls tonight about that particular strain.
Yeah. A lot of people are very concerned about that. It is one of the strains that is part of this year's flu vaccine. So if people can get vaccinated or have been vaccinated, they do have some protection against that, and there's still plenty of time to get vaccinated.
That's always good things for people to know. If you've been vaccinated, that's the best protection you can get against swine flu this year. And if you've been vaccinated in the fall, you don't need to get it again this year.
You don't need to get a second shot. The only groups of people that need to maybe get a second shot are very young children, and they can check with their pediatrician on that.
All right, Mark, thank you so much. Of course, we're going to be checking in with our folks here in the Connect Center throughout this newscast. You still have time to call and ask your questions tonight about flu, H1N1, and vaccination. So just pick up the phone and give them a call. I'm going to send it back over to you, Steph.
Some great advice, Kelsey. Mark, thank you. And you can follow our flu coverage on Twitter using #flu. We also have a very useful website linked to KHQ13. It's called Flu Near You. The site allows you to see flu activity in our area or your area, find nearby locations offering flu vaccines, and gives you charts and graphs that track flu trends. It also connects you with local public health organizations. That's linked to KHQ.com. It's under the Find It bar. And don't forget, got flu questions, call our Connect Center until 6:30, 509-443-1111.
It was a busy weekend for